Okay, so today I'm going to talk a lot to you guys. Usually I'm kind of just in my mode and I go from room to room to room to room and I don't really talk to anybody. I don't have my phone on me. I don't hear from my family or my friends until 8 o'clock at night when I'm done working. But today's going to be a little bit different. I'm going to go ahead and give you guys the attention that I promised. And so here we go. So I just got here and just put my coat on. And now we're going to see what the day has in store for us. Good morning, ladies.
Good morning.
Hi. Hi, everybody. I'll peek at the schedule here. There's another one. Hi. ¿Cómo estás? This patient is an out-of-town patient. So we basically need to do everything in one day. So we're going to scan the implant. We're going to create a custom abutment. And then we're going to mill a crown and deliver everything today. Since he's missing another tooth, we'll also just go ahead and place another implant today while he's waiting around. All done in one day. So beauty. Once the implant is healed and I've uncovered it, like we showed yesterday, then you scan it. This is Teflon, and this covers the screw so that the cement doesn't go into the screw. Another piece. So back when we used to use cotton, cotton harbors bacteria. Another little one. So we stopped using cotton to cover the hole, and now we use this Teflon, and it works really nice. See this position I'm in? This is why I do yoga. These stitches don't dissolve. I use them because they stay very clean and they don't cause an inflammatory response to the tissue like the other stitches do, the more traditional ones. This is my implant drawer, which I keep locked up, and I try to keep a good stock of implants here, so we always have the right sizes for the patient. Most doctors keep like 10 or 20 implants, or at most 30 or 50, but we try to keep, 100 implants because I'm going through about 50 a week, and I need to make sure that I have all the right sizes. So having a good implant stock, this by the end of the week, this is halfway down, and then I need to order again. So before you do your surgery,
It's already done.
always have to sign a consent form.
He has
It explains what can happen, infection, swelling, things like that. Typically with an extraction, you can get something called a dry socket if you're not careful. If you use a straw or do a lot of spitting, the blood clot comes out of the extraction socket and it hurts a lot. Some people say it's worse than labor pain, but it shouldn't happen unless you're not careful. So most people don't get it, but it's a possibility. And if you do get it, you come in and then we address it right here in the office. And usually just one visit will take care of that. That's pretty it for the extraction Almost always when I do an extraction, I place a bone graft the same day, and we've talked about that in our videos before. Ready? Just gonna take a CT scan now.
Con dinero de Cuba, con pesos de Cuba.
A
Eso
ver,
no vale.
¿eso de Cuba?
Sí, David.
Pero eso, ese es el peso que te cambian, que vale más que el dólar.
Vale más que el dólar.
Sí, eso vale.
Vale cada pago con esta.
Sí, la mitad.
Cuban money here at Implant Center of Miami. Look at this one.
It's more expensive than the dollar.
It's more expensive than the dollar.
Only in Cuba.
So,
Only in Cuba, though. Here, I don't think it's worth anything, right? Aquí no vale nada.
no, aquí no sube. Aquí cuando vaya
Papel.
de nuevo, sí.
Un
De allá,
retrato.
de allá por $100 te dan 87.
Wow.
Te quitan 13.
When you have a root canal on a tooth, you don't even need anesthesia to do the crown because the tooth has no nerve, so it doesn't hurt at all. But sometimes I'll give just a little to be able to just numb the gums a little bit so you don't feel me kind of working in there. But it's not necessary if you're afraid of the shot, which you shouldn't be. You know how it tastes. Qué rico, ¿no? El mojito. Tenemos que hacer uno de sabor mojito.
Mojito cubano. O piña colada.
Piña colada hay.
Y no me gusta, ¿tú sabes?
No,
No, I don't like it.
I don't either.
Yeah.
I prefer the mint or the strawberry.
O strawberry, yeah.
What do you prefer? Mint, strawberry, or piña colada? I like to use brand new drills
No son so fuertes,
every time.
son dos compresores.
You might think that's an obvious thing, but a lot of doctors sterilize their drill bits, which is it's okay. But you know, I like to create as little heat as possible around the tooth, and by using new drills, we do that. We'll let you get up close and personal for one of these implants, which will be nice. Yeah, so now we're going to do the other side. I'm going to work on that side. It's in the lower bone, so the bone is a little bit stronger and harder on that side, so I'll probably have to drill a little bit more. You know, like oak or maple wood versus the top being more like a balsa wood or even styrofoam in some cases. That's how the bone feels. You know, patient's a very nervous patient, but he didn't feel any discomfort. He came in today for the first time and he's done all this work, so I applaud him on that. So I did get a 5-minute lunch, which you guys didn't get the pleasure of seeing because it was. And now, what time is it now?
4:27. Wow.
4:27. So now I have left a few surgeries. I'm gonna 1 implant in room 5, 2 implants in room 1. I'm gonna deliver a couple of implants in room 2. And what else is left? That's it. That's pretty much it. And a delivery.
Yeah.
Great. So let's get going. Can't stop, won't stop. Check this out. This is how much water I drank so far. What time did I say it is? I'm supposed to have this much. I'm at 9 a.m. Ready? think I must go through like 25 gowns a day.
Yeah.
Right? We need more? I'll bring you more
Yes.
tomorrow.
Duck.
We are now adjusting the custom-made zirconia abutment for this same-day implant crown. We usually don't do same-day implant crowns, only for out-of-towners or special occasions. So I'm just adjusting a little bit here until I see that it fits perfectly, and then we'll scan it for the final crown. See me using this before. This is a mini torque wrench, and it allows me to gauge how tight I'm tightening the screw so that I don't strip the screw or over torque the screw or place it on too loose. It tells me exactly the torque. Check this out. So this is where the 6 implants go. Let's put it back on there so you can see better. And then this gets screwed onto the jaw, and these are the access holes where the screws go. See? So pretty nice. Snazzy stuff.
Thank you very much.
You're very
For both.
welcome.
For both.
And
Thank you.
let's get this paper. Come with me. Bye.
Bye, thank you.
Okay.
Yo falo português. Yo hablo español. Anida Beret Ivrit. I speak English. And je parle un peu de français. There.
Nice.
That's it. We just finished our day. The day finished at 5:58, which is quite early for us. And let's see, we did several implants. I'm not sure how many, but we did a lot. We did several implants. We did a few implant crown deliveries. We did some extraction and bone grafting. We did implant uncoverings.
Yes.
This is called surgical cap hair, not bed head. We did a biopsy of bone. We did a try-in over 6 implants. We did uncovering of 6 implants with 6 extractions on the same person. So several things. We did a lot of post-ops and checkups. We saw new patients. Most of the new patients had their work done the same day. So you can see that we did quite a bit of work in a day's work, in one day, in 8 hours or whatever it was. We didn't have much time for lunch, but that's the fun of things. We kind of just go with it. And all the patients left really happy. We don't usually get any complaints. Sometimes patients do wait, but like one of my patients said today, if the person in the other room needs you more than I do, then I would just hope that you spend the same time with me when I need you. And that was really nice of her to say, and it's very true. So I spend the amount of time that you need, I spend with you in the room. And sometimes it does clog up the schedule, but things can arise that are not expected. For example, today doing an extraction, we perforated, well, the tooth was perforating into the sinus. So I could see the sinus membrane. Fortunately, it wasn't torn, but I repaired it, and then I did the bone graft. So that was unexpected. Then on another patient that we were just doing a try-in, it turns out that she had a piece of bone that her body was rejecting, so her actual bone. And this was not a grafted site or anything, and her body was actually rejecting that part of the bone, so I had to do a biopsy. And that takes a little bit extra time. There are several things that occur throughout the day that are unexpected, and we don't mind that. We expect it, and we roll with it, and we enjoy it. We enjoy things that are different. Obviously I don't enjoy that a patient has a complication, but I don't mind taking care of these things, and that's what I'm here for. So I hope you enjoyed this part of the day. I am not sure if I'm going to do any more video today, but now I basically will head home, say hi to the kids, the family, and then I have an exercise class at 8 o'clock with, a bunch of my girlfriends, and I'll be home by probably 9:15, shower and go to sleep. Not sure if you'll see that part of my day today, but I hope you enjoyed kind of a day in the life of Dr. Herzog and the team here, who is my all-star team, which I love very much. Have a great night. The scan dance. Don't judge me on my dancing. It's much better with real music.